Hello, everybody. Let's talk about healthcare. Today, well, it should have been July 12th, but it's already midnight. July 13th. I don't know why I'm doing this super late. Um, I don't know. I guess I like reading stuff when I'm supposed to be sleeping. But nevertheless, let's talk about it. So today, the market hit all-time highs. It couldn't hold too much. Well, the healthcare sector, right? Increased volume, still pretty strong, which is good. One of the major news that I want to talk about today is Joe Biden, Sleepy Joe. So last Friday, I believe, July 9th, I believe that's last Friday. Let me double check. Yeah. So he signed an executive order, and it pretty much focused on like antitrust to promote competition throughout the American economy. And of course, you had to have touch healthcare. And when it comes to healthcare, we want to, improve drug costs and overall competition. So let's get into it. So prescription drugs, we all know that we pay so much compared to, other economies throughout the world. So let's make it better. Um, the pharmacy industry is so goddamn complicated. I get headaches just thinking about it. Oh my God, it's a bitch. But yeah, so it's going to tackle, it's going to try to decrease drug costs. And how do we do that? Well, we're going to have to figure that out, right? It also talks about hearing aids. So apparently, hearing aids are not sold over the counter and they're super expensive. On average, they cost more than $5,000 per pair. What the fuck? That's fucking crazy. See, I didn't know that shit because, I see the batteries. Like, I go to Walgreens, right? Fuck, Walgreens. I like Walgreens. Go to Walgreens, I see the batteries, and I'm like, oh, hearing aids, cool. They're probably not, but they're like 5,000 a pair. Shit, that's too much. Hospitals is going to be the main topic for this video. So consolidation, mergers and acquisitions. It's an issue when it comes to forming monopolies, forming competition. It decreases competition, and when you have less competition, price. You can control prices, and that's what we're scared of. At least I'm scared. Shit. Especially in the rural areas, they have been affected the most. It says here since 2010, 138 rural hospitals have shuttered. Damn, last year 19 have been shuttered. That's a whole lot, and these areas need it the most. But we're over here shutting shit down. That should not be happening. Health insurance, we need more competition. A little choice is gonna screw you over. So yeah, I like this. I support it. We need more competition and survival of the fittest, right? Um, yeah, I fuck with it. Let's see. So yeah, hospital mergers. Any big hospital corporations that are getting spanked, well, they should be scared. Or should they? Because hospital compliance is shit. Um, there was a price transparency rule that was passed recently, and they're supposed to, um, publish prices for, some of the most common procedures. However, hospitals are not listening. They are not compliant. I have more exact numbers here. Where is it? So, 83% of hospitals. Um, this was a study done by the Harvard Medical School. And let's see. 83% were not compliant in at least one rule, and the top earning hospitals were not compliant. Fuck, 75% non-compliance. Like who the hell who's in charge of this? This transparency rule, CMS. What, does nobody respect them anymore or what? What's going on here? I don't know. We gotta get this shit cracking. I know why. Because if you don't comply, your maximum penalty is $300 a day. That's like a penny to these hospitals. But like, what the hell? Am I gonna spend my time trying to comply with this little rule, or am I just gonna cop that 300? I'm gonna cop that 300. So I don't know. Either they gotta get this, um, what is it, penalty? Gotta make it more expensive or something. But at the same time, fuck, you really don't wanna. I don't know. It's so complicated. I think it just takes more time. But hopefully these hospitals get their shit together. But yeah, this was an interesting article that I found. This is done by Kaufman Hall. Pretty much, so from 2015 up to 2021. So for transactions, merger and acquisitions, a combined of quarter one and quarter two. Check this out. 2015, $12 billion. 2021, $17 billion. And of course, it kind of fluctuates. But here's the thing. Bigger mergers happen this time around compared like there's only been 27 transactions and the average seller size is $638 million. That's the most expensive it's ever been. That's goddamn crazy. But yeah, it's just a trend, man. Like transactions are lowering, but it's just the bigger transactions that are happening. Um, so why? Why the hell do we want this? Well, let's say a hospital is based out of, let's say LA County. This is just hypothetical. LA County, an LA County hospital wants to expand. They're going to expand to their neighbors, right? To wherever it's more convenient for them geographically. Why the fuck would an LA County hospital want to acquire a hospital, let's say in Florida? It's going to make things a little too complicated. They can share the resources if they're close together, so that's an incentive. But is it that beneficial? Well, top 10 health systems now control 24% of the market share. This is the world we live in. Holy fuck. God damn. Was that the Pareto principle, 80-20 rule? That's my favorite rule. Where 80% of anything comes from 20% of something. But in this case, the top 10 make 25%. I don't know. I'm getting my numbers mixed up. But that's an interesting number. But why? Well, and this is a forecast. So this is done by Deloitte. So Deloitte, they're forecasting that, well, the mergers and acquisitions will happen in every market. It's not just healthcare. I mean, it happens everywhere, right? But why? Well, they want to focus on a care delivery model and others for survival. And I think survival is one of the most important ones because once you see a hospital that's struggling, let's say they're not getting enough revenue, well, fuck, how do they make up for it? Well, they got to attach themselves to other assets, to other forms of revenue, and the easiest way to, I mean, shit, probably not that easy, but fuck it, let's just join somebody. What's the saying? If you can't beat them, join them. So that's what's going on here. Um, yeah, this article is pretty interesting. I'm just showing that the top 10 health systems, they just keep getting bigger and bigger, right? So from 2013 here, they were at 1.9 billion, and now in 2018, 2.8 billion. So they're growing. This is 45% growth in 5 years. That's crazy. Um, and they're pretty much predicting that with the more consolidation that happens for hospitals, the real growth would be in the outpatient setting. So they're expecting um, outpatient grow from 20% to 48% of the overall hospital revenue. Sheesh. I guess I'm in a good setting because pretty much what I do is outpatient. So shit, I think I'm good. But I think I found that pretty interesting. So I think I might have to look into when I plan for my future, I don't know, career development. Maybe I gotta focus on outpatient if that's the future, right? And I mean, I hope it is. Preventative care is all done in outpatient. Why the fuck would you get preventative care in the hospital? Doesn't make sense. So I think that's probably true. Um, yeah. So inpatient hospital revenue will lower 35%, and hospital beds will lower 44%. I mean, this is just Deloitte, you know. I mean, they sound pretty smart, right? So I can kind of believe them. But yeah, Let's see how the market is doing. HCA Healthcare. So this is a pretty reputable healthcare system. They pretty much don't give a fuck. Yeah, I don't know. Sometimes the market, I mean, everything's forward looking. And this is Tenet Healthcare, another hospital system. And yeah, the market doesn't seem to give a shit. Well, I don't know. They got earnings coming up pretty soon. So I'll be interested to see how they perform. This is, oh shit, I'm not connected to Wi-Fi. That's what's not working. But yeah, within the next week, right? Next week or two. So yeah, we'll see how they do. I will catch you guys later and hope you guys have a good Monday evening. Damn, well, sorry, Tuesday. Cool.